Thank you for joining the Everything Old School podcast. I am Shanique Bird.
And once again, I'm Marquise Marrow. And we have the pleasure to have Miss Maria Davis, who I call Everything Woman because she's involved with everything.
Hey there.
How are
Hey,
you?
how you doing?
I'm doing fine. Thank you for being a part of this because I know you just came from Vegas yesterday. Are you rested up yet?
No, not really. I'm trying to figure this time thing out, but I'm making it happen now.
Yes, yes. Figured that. So I'm gonna start off asking you I got a few questions for you. I won't keep you too long. We won't keep you too long. But I know
Well,
you're a
you gonna
committed.
introduce me and tell the people who I am?
You you you
Right.
you, you do that. You tell them who are you, Maria?
Okay, all right, all right. My name is Maria Davis, music industry insider, godmother of hip hop, and also an AIDS survivor of 20 plus years out in the community, registering people to vote, helping people get vaccinated, those that want to be vaccinated, and just trying to help my community to stay healthy. And as if you're healthy, then you can be wealthy.
That's for
And,
sure.
and I have my own non-for-profit organization called can'tbesilenced.org.
Well, that's good to know. Now I know you for a long time now, and I've seen you do so many things. But I want to start off with the showcase with the artists because I remember you brought Brandy to New York before Brandy was Brandy.
Yeah,
I
Mad
remember
Wednesday.
Mike Epps. You had Jay-Z all the time. I was telling Shanique that you're on Jay-Z's first album. So I want to know how long have you been doing showcases and what made you start doing it?
I've been doing Mad Wednesdays has been in existence since 1994. Before that, I was doing NBA parties with my good friend Mike Dean, Mike DeBarbara, Leah Wilcox over at the NBA. You know, we were all finding our way. So um, the networking that I had, the networking circle that I had, I want people to know your network is your net worth. And so I
Uh-huh.
had many people that was in the music industry and in various other industries, entertainment industries. So we all collaborated. They helped me, I helped them, and that's how we made it happen. And the reason why I started Mad Wednesdays is because I was so connected to so many music industry people. I love music, and it fit. It made sense because I had connections. I was with Russell, Andre Harrell, Deidre Tate, Mike Bernardo, Rob Love, anybody you could think of. I had connections in promotions and I had connections in PR. And, I saw that my young people didn't have those connections and how I could bridge the two together to introduce some of my young and up and coming artists to the people that I knew that was movers and shakers in the industry. So I got a couple of people signed. They didn't have major deals, but they got signed. And I was able to put them on with artists that were just starting out themselves, like you said, like Jay-Z, Case, Mace, 50 Cent, Little Kim, Missy Elliott, Kaz, Exhibit, Mike Epps, Bill Bellamy, Bernie Mac. The help of my friend at the time was Bob Sumner. He was doing Def Comedy Jam. He was doing the Peppermint Lounge. Tina Graham. So, those connections were very important, and we all loved and supported each other in what each other's journey was. So I was very fortunate.
Right. And you're still doing it. And for people who don't know, could you tell them exactly what Mad Wednesdays is?
Mad Wednesdays is a showcase, a new artist showcase, but we have an unsigned and signed artists. And it really is like the kind of training camp. I don't want to use that because my friend Mental Supreme had a show called Training Camp, but it's to help artists hone their skills. That's what I'm going to say. Become better artists. Sometimes the artists get up on the stage and figure out that they don't want to be in the front on the stage, that they want to be behind. They better at writing. They better at producing. They better
Right.
at making beats. You got Tone Hooker, Ski Beats, DJ Clark Kent, who was at one time the A&R. That's how I got looped into the Jay-Z and the Dame Dash original flavors, because that was the artist that Clark Kent had signed on Atlantic Records. He was an A&R at Atlantic Records. So shout out to my friend. We just celebrated the 25th anniversary of Reasonable Doubt in June, towards the end of June, the 25th. And so, you know, we still, Reasonable Doubt was a mover and a shaker album. You know, it was about all of our lives, about all of us coming up and, you know, supporting each other.
Right. Do you still keep in touch with Jay-Z every now and again?
Well, not directly, but indirectly. You know, Shaka Pilgrim, you have Emmanuel. You know, during the pandemic, I was taken care of from Jay-Z through, you know, through my sisters.
Right.
Who still continue to take care of me. That was a part of the Rockefeller family.
Yes, indeed. Go ahead, S. Bird.
So you mentioned that you have an organization. Is that correct?
Yes, can'tbesilenced.org.
So we also know that you are an AIDS advocate.
Yes.
Right? And tell us how that came about.
Well, you know, I was always one who cared about the community. And I was diagnosed with HIV in 1995 through a life insurance policy. I wanted a policy of $100,000 for my children. I have two children, Jonna and Josh, and you had to take a test. You had to take an HIV test. You couldn't have any pre-existing conditions. So when they told me to take the test, I was like, okay, fine. Only gay white men get HIV. And little did I know that I would be the one who was diagnosed with HIV and needed to go and seek help. So Prudential sent me the letter. It was Prudential life insurance policy. A friend of mine worked for them, good friend of mine named Sonny, and I took the test. They sent me the results back saying, we reject your life insurance policy, but you need to go and seek help, that you have HIV. You have the HIV antibody.
So at that time, did you ever think that you could possibly be infected with HIV?
Nope, and nor did any other Black person either. None of us thought it. We thought we were superhuman. African Americans didn't catch anything. And so, you know, although Magic Johnson came out, but, you know, couldn't talk to Magic Johnson. And, you know, I didn't know any other women, Black women at the time, who were HIV positive. I knew about women that were celebrities. I knew a celebrity woman. I can't remember her name. She was on the cover of Essence, and she's going to kill me because we do speaking engagements together. But my mom, excuse me, no, Shirley Ralph is not HIV positive, but she was one of the ones that brought all of us. Actually, she took 30 of us to South Africa and to fellowship with women that had HIV. So we went to South Africa, Gukuleti, back in 2011. We went there for about 8 days, and we bought all kind of items. We donated money, and we went and we fellowshiped with our sisters in Africa. And, you know, we thought our lives was in shambles because we found out we were HIV positive. But we talking about women that didn't have a choice, that was raped, gang raped. Oh my God, the stories was crazy. And, you know, it gave me a different perspective, you know, where you think that you're doing the worst, somebody else's story is just as compelling as yours. So I don't want to say that they were doing worse than me, but their stories were very compelling.
And when you found out you were HIV positive, what was that moment like for you? Like, could you relive that moment, finding out you were HIV positive?
Yeah, it was denial. I mean, I had 2 children. What was going to happen to me? Back then, you didn't have no support system. You didn't have people talking positive about HIV. They called it the monster at the time. And that was the gossip. The stigma was very serious in our community, you know, because that was you did bad things if you got HIV. If you had AIDS, you did super bad things. Right. Like you was on the corner hookering, or you was sniffing, or you was getting high with the needle. That people didn't understand that all it takes is just one time.
Right.
You could be married in a relationship, monogamous relationship, or in a relationship and you're not married, but you think you and your man, or your man think, because I ain't only gonna blame it on men. There are women that give their husbands and their spouses HIV too. You know, one time when I started doing the Michael Bazin show, that's when he was on Kiss FM. And I first got to do a show because a young woman had called in and she was very angry because somebody gave her HIV. So her sister was very upset. And she was telling the sister she was going to give everybody HIV. She didn't care because the person didn't care about her. And that's how I wound up doing a Michael Bazin show like several times and talking about HIV and the transmission. And, you know, I mean, how to love yourself. And the most important person to love first is God and you, not man and you, but God and you.
Right.
So,
I mean, I think that's an important thing to say, that you could be in a monogamous relationship or think you're in a monogamous relationship. People, there's so much stigma with HIV. How did you get around the stigma and have the power to own what happened to you and to be a voice of support for other people like you?
God first, because I couldn't have did it without a faith walk. They say the Crip walk, I'm talking about the faith walk. And then surrounding myself around positive people. You had Deborah Frazier from the National Black Leadership Commission on AIDS. You had my friend Leatrice from the Harlem Directors Group. I'm a client. I was a client at Faces. I was a client at Harlem United. I went to, I was a part of a group called Friends Indeed, was a white organization. And every time I went there, I had a sprinkle of us, but they were down in Soho on Houston Street. And I would go there, they would have support groups. And every support group I went to was nothing but gay white men. So I had to find myself in those spaces and, you know, build who I was. And thank God for prayers, people that prayed for me. I was at Canaan Baptist Church in Harlem at the time. I'm at First Corinthian Baptist Church now in Harlem, but Canaan is my family. And, you know, having praying people, praying mother, you know, praying family members, but also, you know, even in my own family, you know, people had the stigma, the stigma bug, you know, that AIDS was a curse, you know, was a sin, some sins that you had in your back life, you know, you had children and you weren't married, you know, all those biblical things.
Right.
But all I can do is say, but God, because that at the end of the day, it's God that judges me, not nobody else. So I had to, you know, learn to maneuver through all of that. And, you know, I'm just thankful that, you know, information is power, not only with HIV and AIDS, but with any illness that you're going through. You know, breast cancer is #1 amongst Black women. Hepatitis C, Black people. Diabetes, high blood pressure, heart disease. We're #1 in every facet of health disparities.
Every facet.
African Americans and because of conspiracy theories. Who died the most during the COVID? I don't care if you're a conspiracy theorist. I don't care if you think it was put in our community the same way we thought AIDS was put in our community. Do I believe it? Yes, I believe it. But guess what? That wasn't helping me live. I had to do things to help me live. I could either focus on the conspiracy and the negative that causes stress, or I could say, God, point me in the right direction. Show me the opportunities, open the doors that I meet people who can educate me and help me to live a whole life. Dr. Sabi, who is no longer with us. I did his program and I still continue to do it. Heart Smart, another organization I'm a part of now. Dr. Teti from Columbia University. We walk. They're trying to get all of us to be vegans because the food is killing us. It ain't only our lifestyle and it's not only our stress, but it's the food that we're eating that's killing us. That's what we found out during COVID.
I admire you for living your truth. How did you forgive the person who infected you with HIV?
You know, if you love God, then you love forgiveness. Because forgiveness is not for the other person. Forgiveness is for you. So that you can continue your life. Because you worrying about that other person and that person ain't damn worrying nothing about you.
Right. Now, what would you tell people now? Because the people don't really talk about HIV. I had someone tell me that HIV is a thing of the past.
Girl, it's a silent disease now. And people are still getting infected with HIV. African Americans still make the highest number of HIV infection. Black people.
Yeah.
I ain't gonna say black and brown. I'm gonna say black people.
Right.
We still in them. Women still have the highest number. Men who have sex with men. I don't care who you love or whom you love or how you love them. But what I'm concerned is, how do you protect yourself?
Right.
Because nobody's going to protect you like you protect you.
Right.
You putting on the armor of God. I told people HIV ain't just about having sex. It's putting on the whole armor. It's not just the condom. It's honoring your spirit, your soul, your body, your temple. And what do you do in your own life to move forward in living?
Right. They talk about this medication that they have that you don't really have to worry about HIV because it's undetectable in your blood, and you can. So tell us about the medication and how it actually affects somebody's body when you're on this type of medication.
You're talking about PrEP. So to be on PrEP, you have to be HIV negative. Although PrEP is an HIV medication that patients take, but you have to be HIV negative. You have to stay HIV negative. You take the medication every 3 months. You go back to the doctor. They have to take your blood levels of your liver and your kidney, because these, although medications have come a long way, back when I was first diagnosed, there was no medication but AZT. And then the medication came along and it was very toxic. So I have what they call peripheral neuropathy from my knees down to my feet, my lower extremities. But the medications are still toxic because you're taking it. And so you take the pill once a day, and you got to take it as prescribed at the same time every day. Because what people don't realize, even in regular medication, if somebody puts you on an antibiotic for 10 days, you have to take that 10 full days. If you take it 10 a.m. in the morning, you got to take it 10 a.m. every morning. Because what happens is when you miss hours, the levels change. There's not enough coverage in your blood at the time because you took it at a different time. So you have to take the medication as prescribed every day. Now they do have PrEP on demand. That's a little more difficult. A little more advancement for people to say, oh, well, I don't have sex. I have seasonal sex. I have more sex in the winter than I do in the summer. So they would tell a person that you could take PrEP 3 days before you have sex and then right after you have sex. And you're supposed to be covered that you don't get HIV. Now, is it 100%? No, it's not. There's nothing 100%. The only thing that's 100% is abstinence. Right. I know we don't live in an abstinence world because everything's about sex. Reality TV is about sex. One season, somebody's having sex, they married, they straight. Next season, they LGBT, they marrying their girlfriend, they marrying their boyfriend. Nobody's talking about condoms. So there you have it. So it's called PrEP, PrEP. And, that's for people that they say at risk, or people that, come to the emergency room. There is another medication called PEP. PEP is post-prophylactic. PrEP is pre-prophylactic. So PrEP you take before, and PEP you take after. That's somebody who might be a sanitation worker and get stuck with a needle, a doctor or nurse that's handling someone and get stuck with a needle. You would go to the emergency room within 72 hours. I say get there as soon as you can. Or you might have a relationship with somebody and you finding out the next day that somebody's saying they think that they're HIV positive. You go to the emergency room and they can prescribe you PrEP. Prescribe you PEP. So PEP you get in the emergency room. It's prescribed. It's for 28 days. You might take one or you might take 2 pills. And you take that regimen and, you won't become HIV positive.
Okay. Thank you. I've always, had so many questions about HIV because people just don't talk about it anymore. And I believe they stopped talking about it because you have a lot of people that don't want to correlate the homosexuality with the, HIV. And I think that because of that, HIV went silent. And I think it's important to talk about these issues because it does impact our community.
How about the LGBTQ community ain't talking about HIV neither? Nobody talking about HIV. So it ain't only the heterosexual, nobody wants to talk about because we're living longer, we look good.
Right.
But people are still being devastated. Somebody called me the other day, told me can I talk to their family member? Their family member just got diagnosed with HIV.
Wow. Wow.
So people are still being diagnosed.
Right.
Because you're having unprotected sex. You know, when people are going through difficult times, domestic violence, people were stuck in the house together. You know, this man is beating on you, this woman, I ain't just going to say a man.
Right.
There are men who suffer from domestic violence also. You're living with this person, now the predator is with you 24/7.
Right.
They're forcing you to have sex with them. You don't know who they've been with, where they've been, but all you know is that you trapped.
Right.
So, you know, we have to continue the conversation. We cannot, in our community, we can't stop talking about nothing.
Right.
We can't stop talking about incarceration of our Black children, our Black male children, the pipeline through prison from public schools that are not fully equipped, that our children didn't have laptops during COVID. Scott Stringer talked about that today. Why did they fall by the wayside? That every child was promised a laptop and did not have one. Then after they got the laptop, they had no internet because they were in shelters. A lot of the people don't even know the numbers of young children that are in shelters that go to public school.
Right.
So, you know, we have all of these things to deal with, and each and every one of us are responsible. We are the village. We can't leave the village for Malcolm X, for Martin Luther King, Al Sharpton. They are a part of the village, but we are part of the village too. We have to participate in saving our community. And that's my job. And I challenge everyone. That's everyone's job. We can no longer sit back, talk about what we don't have. Listen, our ancestors didn't have nothing, but they had more than we had.
Right.
Our ancestors sent children to college. And we got jobs and making money and doing this and doing that. And we still can't save and do nothing because we're in debt.
Right.
We're consumers. We're not business entrepreneur people. We're consumers. We like to buy everything that belongs to everybody else. When we need to be supporting and creating, getting our children to be part of the code, learning codes and how to create apps.
Right. Right. Now, what advice would you give young women, young Black women who were like you? What advice would you give them now?
To be a part of organizations that are out here. You got Girl Code. You have all, now that we are on Zoom, you can go on Eventbrite. I work with the Harlem Business Alliance. They have classes, free classes, every damn near twice a month on how to start a business, Google Analyst, how to start a non-for-profit, how to get money. It's all free. All you have to do is Google, go on Eventbrite, and you can find it. There are free classes out. The city gives free classes. The state gives free classes. And be a part of something bigger than you and learn how to network. Your network is your net worth. Don't be on Instagram all day and trying to be an influencer and getting people to like and follow you. Guess what? Like and follow yourself. You ain't got to have 1 million people because will those 1 million people buy your product?
Right. Exactly. Exactly. Marquise, go ahead.
What I wanted to ask you is, I know certain diseases, like I work in the environmental industry, and the doctor has to keep our records for 30 years. Because, for instance, like mesothelioma, I still can't say it right, but it can show up 30 years later.
Absolutely.
So
look at 9/11. Look at 9/11.
Right,
all of
right.
those people that have cancer now, all those people that died because of smelling that air.
30 years ago. So what I wanted to know about HIV, can it stay in your system? Like, can somebody have been diagnosed in 1990 and then it lay dormant and now 30 years later they have HIV?
No, that's not like that. The only way that can happen is if they have not been tested. Everyone has to, if you've been sexually active, you need to get an HIV test.
Oh, and I brought my wife. Me and my wife came down to the shrine and got tested. I was shaking. You remember? Well, you probably don't remember it so many times, but it's good that you provide a platform for the inner city people to come and get tested, and for free, I might add.
Yes, so, for free. You know, I work with Iris House. I work with Ryan Health, and you know, National Black Leadership Commission on Health. And I work with many different organizations, community-based organizations, to give people the opportunity. I bring testing to at the shrine when I do the showcases. I'll start back, you know, start back with my showcasing on August 18th. I got to try to figure out how that look, because this new variant, this Delta variant, ain't no joke. And it's also people that are vaccinated are getting it because it's a little stronger. You know, because you got vaccinated, that don't mean it is a cure. It means that if you get sick, that you won't get sick to death and you won't have to be put on a ventilator. But from my understanding, this Delta variant ain't no joke. It is wreaking havoc amongst everyone. And those of us that have underlying health conditions, listen, don't wait for that next wave come. Start taking care of yourself. Eat better. The food is killing us. Eat better. Take a break from meat. Take a break from sugar. Take a break from salt. Drink more water. Our body is made up of mainly water. Drink a lot of water. Do some walking, exercising, build your muscles. As you become older, your muscles become atrophy. Build them up so that they don't get weak on you.
Right. And I wanted to ask just a few more questions. Well, once you got diagnosed, how did it change your life? How did it change your thinking? Did it motivate you to become an activist? Like what changed in your soul, in your mind? What changed?
Wanting to live. That'll change you. Wanting to live.
That was deep.
Wanting to live.
And you look so good. I mean, I would never be able to tell. But what I also wanted to know, is it the food that you eat, or is it certain medicine that's keeping you up, or certain new? Because like you said, when you first got diagnosed, it wasn't really that type of medicines, too much medication that people could take, at least that I know of. So this many years later, is there a certain type of medicines, or is it the food, or both that keeps you up?
It's medicine. It's how you think about life. I wake up every day anticipating to do something great.
Mm-hmm.
So you can't, if the doctor told you you're going to die and you accept dying, then you will die. But if the doctor tell you, you know what, I don't know, and I think you're going to die, it's up to you to say, no, I'm not.
Was there any point that you felt sorry for yourself? Did you go through that stage?
Come on, age. Yeah, you're going to feel sorry for yourself. God, I have 2 children. Why did I make such a dumb mistake? Absolutely. I beat myself up. Who wouldn't? Nobody's going to take a diagnosis like that. There's stages. You know, same thing as if the doctor tells you the C word, or the doctor tells you have some underlying condition that can't be cured. You know, woe is me is what happens first. Denial. And then you decide either get busy living or get busy dying.
That's deep.
Do you know who exposed you to HIV?
Absolutely. The gentleman I was dating, and I thought I was going to marry him, move to Jamaica, West Indies, and live forever. Because I thought men in the islands were different than men in the United States.
So people are people, huh?
He didn't fool me. I fooled me.
Right.
I tell women all the time, stop lying to yourself. Be honest. If you see a sign, because God gives us all a gut feeling. And I had a gut feeling and I didn't react to it.
What was that feeling?
That he wasn't right. that he was not right.
Mm. Your answers are very short and profane, though. I mean, it's they're not long and drawn out. They're straight to the point, and I appreciate that.
You're welcome. I mean, what you gonna say? You have to live with it.
Right.
So what are you gonna do? All you can do is live and be better and give other people information and let them know. You tell them your story. That's what healing is about. Healing is not only just for you. Healing is about healing somebody else that might need the information and you helping somebody else that don't have the information.
Right.
And
Now, go ahead. I'm sorry. I thought you finished.
And being vulnerable and being honest with people.
Right.
Right.
How is that even to date? How do you date at this point?
Girl, people scared of me. They think that I'm some incredible human being. I am an incredible human being, but I'm just regular like everybody else. I just decided that, I was going to kick death in the ass with God's help. Mm-hmm. That's all. We're in trying times, not only for people that have HIV, but for women, period.
Yes.
I went to Las Vegas and I said it was 8 of us that went on a girls trip with one of my girlfriends who's sick. We want to just, not that she gonna die tomorrow. Any of us can die tomorrow.
Right.
But we decided to go with her. That was on her bucket list. We had an awesome time. But I said, well, as we went out, I said, there are no more single men. Like when you years ago, like in the early 2000s, you go out, you get one guy to rap to you. It's like nobody. Yeah. I don't even feel bad. My girlfriend's just got it going on with all kind of jobs and all that.
Yeah.
She can't get no play, huh?
No play.
So what I wanted to ask you, for people who's listening and might not know where to go or might be embarrassed, where can they get tested? And could you tell them of some organizations that they want some information or knowledge about the disease? Could you give some information about that?
Well, the one thing that I want to tell people, HIV, when you go and take a test, you take an HIV test. You do not take an AIDS test.
What's
AIDS
the difference?
is not a disease. HIV is the infection that breaks down, is the virus that breaks down the immune system, which causes AIDS. And then AIDS causes, you don't die of AIDS, you die of complications due to AIDS. So once your system becomes ravished, so for you to be diagnosed with AIDS, your T cells have to go under 200 and or your viral load is to determine how much virus is in your blood. My viral load was 1 million. A person who does not have HIV have no virus in their system. So you have to go under 200 T cells and or, your viral load is a substantial amount of viral load. And now, even if you are diagnosed with HIV, at one time they say if your T cells were 500 and better, because that's a normal T cell count. Say you just got diagnosed with HIV and your viral is very low, and your T cells, that's the T cells are the fighter cells that help against infections and viruses. Say your T cells are pretty good, they still will start you on HIV medications anyway, because although your numbers are high, the HIV is still working on your immune system. Wow. So that's the first thing a person needs to know. The transmission is through sex. Anal, vaginal, blood, semen, vaginal secretion, breast milk, but breast milk is very rare because today babies are not being born in New York City, New York State. I'm not saying that because you can go down south and the HIV numbers are crazy down south and they don't get the type of care. We're very special in New York and in LA because we get care that other people don't get, because the epidemic was in New York and the epidemic was in LA.
Most people, there's a lot of people.
Yeah, and if you've had any kind of STDs, STD is the disease, there's no cure, or STI is what I should say. That's gonorrhea, syphilis, herpes is STD because herpes can't be cured. So all of the H words are STDs. That's
Oh.
HIV, can't be cured. Herpes can't be cured. Hep C has a cure right now, but it depends on how much damage has been done to your liver. And HPV.
Oh,
There's
wow. I
no
never
cure
even thought
for
about that. The H's. I
yeah.
never even
And young
connected
people told
those.
me that, honey. All the H's are diseases that with no cure. And
Oh,
STIs, gonorrhea, syphilis, chlamydia, all of those diseases where you could be treated with an antibody, those are STIs. Because before, remember before it was called venereal disease.
right. Okay, so that's how they're separated. Thank you
Yeah,
for
that's how
that.
they're separated. So HIV is an STD,
Okay.
not an STI.
Okay.
Oh, okay, yeah, that's definite. I would have never thought of that either.
Yeah, so
For
the
people,
most
where could they get tested at? Not only in New York. Do you know any places outside of New York in case somebody from Egypt is watching or something?
okay, so you could call.
Now, is just this in New York City or the
No,
tri-state area?
I'm giving you a number. You could go to the CDC.gov website. Any
Okay.
information you want to know about AIDS, but it is an 800 number that I am trying to find
Okay.
that can get, and I should have had that number myself. You could go to AIDS, you could go
CDC.gov.
to AIDS.org, but CDC is more important that you go to
Okay.
the CDC website. Let
Okay.
me see what the CDC has, what number they have. Center for Disease Control. And they give you HIV basics. HIV stands for human immunodeficiency virus. It weakens a person's immune system by destroying important cells that fight disease and infection. There is currently no effective cure for HIV, but with proper medical care, HIV can be controlled. Some groups of people in the United States are more likely to get HIV than others because of many factors, including their sex partners and risk behaviors. This section will give you basic information about HIV, such as how it is transmitted, how you can prevent it, and how to get tested for HIV. So this is great. CDC.
Okay. Is it true that the spermicide on lubricated rubber kills the HIV virus?
Nope, don't believe that.
Okay.
The only thing that's gonna kill HIV is wearing a condom on you. Not just no spermicide, but wearing a condom, not a lambskin, but a latex. And if you're allergic to latex, they have polyurethane. And most of the time, polyurethane, they do have polyurethane condoms, but women's condoms, female condoms are polyurethane. Not only are female condoms polyurethane, but a woman could put the condom on 8 hours before she knows that she's going to have a sexual encounter. So that outbeats the male condom. Then you ain't got to be moving and shaking and trying to kill the moment. She can put it on 8 hours and there you go. And it's like a tunnel. So men will be like, oh, the condoms are so small. I'd be like, kill that noise. If you
Right.
need a big condom, a female condom is like the Lincoln Tunnel.
It's round, isn't it round or something?
Yes, it sure is.
Yeah, I remember seeing one. I didn't know they had one until I saw that.
There's a lot of women that don't know about the female condom, and I'm sorry I don't have one with me because normally I'm doing HIV 101, but I can come back and show them condoms.
Definitely.
But anyway, living is about you making the decisions and the choices. Now, you can love a man more than you love yourself, but I don't know how far that's going to get you. As you see, didn't get me far. I'm living with AIDS, but thank God, God saw beyond my faults and said, this is my anointed one. I know she's going to do the job. She got a big mouth and I can use her in the fight. And so, I don't want somebody to have to go down the road of being diagnosed HIV. Love yourself enough to know that you deserve the best in life and that the person that you're with cares about you just as much as they care about themselves. And you go to the doctor, and it's not only just about HIV and AIDS, it's about living your life and living abundantly. And we can't do that if we're not healthy. Money is a great thing, but if you don't have your health, your wealth, your health is your wealth. To have money and be sick, You have great people like Biz Marquis that just passed, DMX. We've lost 4 major icon hip hop artists in the last 4 months. Black Rob, Prince Marky D,
Right. Mm-hmm.
Houdini, Ecstasy from Houdini. You know, we lost some great people, and they didn't die because of old age, but they died because of complications of health.
Right.
All in their 50s. They're still young.
Right.
Yep.
That's what I was saying. A lot of us aren't even making it to 60, 65. We're dying late 40s, early 50s. Like that is crazy. And it is due to the way we take care of ourselves, the way we eat. We do not have the proper health care in our community. And we do have to do better when it comes to these illnesses that are impacting our communities.
And you know, I get it that we don't have the best hospitals, we don't have the best care. But guess what? You still can take care of yourself.
Yes.
If you know your heart ain't feeling right, go your ass to the doctor. Mm-hmm. If you don't like that doctor, you can go to another doctor until you find the right doctor. I had 2 hip surgery replacements. I didn't just go to anybody to do my hip surgery. I did my work. I wound up getting one of the top hip surgeons in New York City from Canada at NYU Clinic.
Mm.
So there are great doctors who give back in the clinics. You just have to do your research, and don't wait till you're dying to do the damn research. Do it now. The body lets us know if you're in pain, that means something ain't right.
Right.
Yep.
Now I have something that I call 10 in 20. It's 10 questions that you have to answer in 20 seconds.
Okay.
Do you need a second? You need a minute? To look at what you're looking up. You ready? Okay. Would you rather be respected or loved?
Loved.
Do you like summer or winter better?
Summer.
Who's your favorite singer?
Kenny Green from the group Intro.
Who's your favorite group?
OJ's.
Do you prefer to be behind the scenes or in front of the camera?
Behind the scenes. Sometimes in front of the camera. Depends.
What do you like being better, a grandmother or a mother?
Grandmother.
I knew you was going to say that. Do you like driving or you prefer a driver?
No, driving.
Old school movies or old school music?
Both.
Okay. Old school R&B or old school hip hop?
Both.
And the last one is, if you was going to see a movie, would you go see a comedy or a love story?
Love story. I love love.
Oh, I couldn't get. Go ahead, Esmer.
So how do we stay updated on you? Are you on social media?
Yes. On social media, I am on Instagram. I'm Davis_Maria13. You can find me on my website, can'tbesilenced.org. You can leave a comment if you like. Please do that. I love to read comments. If you like my page, you think something's missing, you can make a donation on my page. Also on my website, can'tbesilenced.org. Facebook, Maria Antoinette Davis. Twitter, Maria Speaks to You, the number 2 and then letter U. And you can Google me. Google Maria Davis plus AIDS.
And where will you be doing testing at?
Oh, I work with everybody. Oh, so I have National Night Out coming up, which is in all the 5 boroughs. National Night Out Against Crime. That's when the police department comes together with the community to try to build community between the police and the community. And that is everywhere on August 8th. So I'll be at the Harlem State Office building, and I will have Ryan Health, and I will have the National Black Leadership Commission on Health there.
That's August 8th.
I'm sorry, August 3rd.
Oh, that's next week.
At the Harlem State Office building. Okay. On West 125th Street and Adam Clayton Powell, 7th Avenue.
From what time to what time?
5 to 9 p.m. And I
Okay.
have a live band and I have a show out there also. But we will be doing high blood pressure. They will be giving COVID vaccines out
Can I
that
get
day
on?
too. Yes, they sure will.
All right. I'll be there. Ready
All
to
right.
get on.
Mm-hmm. This has
Thank
been
you
a
so much.
very powerful conversation, very knowledgeable. I appreciate it so much. That's exactly what I'm trying to do on my platform.
It was very nice meeting you. And thank you, Marquise, for inviting me to
Thank
your
you.
podcast. It's
It's
Everything Old School Podcast.
yes.
Everything Old School Podcast. Marquise is the one who
She's the
made up the
boss
name.
lady.
And it was nice meeting you, my sister. And God bless you and Marquise and your family.
Thank
And
Thank you.
much health, much success with your podcast. And that people will listen wherever they can hear.
Yes, thank
Don't
you.
have
It
to
was a
be no
pleasure.
big podcast, no major,
Right.
person, no star giving you information. Information comes from everywhere and it can
Yes.
come from anywhere.
I think
So
information is better from real people anyway.
anyway, that don't have an agenda,
Right. Exactly. That's
just
exactly
want
what
you
I
to
believe.
live. Yes.
Hmm.
So thank you
Thank
for
you.
having me. And I hope you
Thank
invite me
you.
back again.
Definitely.
Yes, indeed. And God willing, I'll see you on the 3rd.
Yes, sir. Yes, sir. God bless you.
All
God
right.
bless
Thank
you.
you.
You're
Thank you.
welcome.